Your doctor handed you a prescription of methotrexate and said, take this once a week. And maybe they told you it was a chemo drug, but maybe they didn't mention the nausea, the fatigue, the hair loss, and the alcohol restriction. And now you're scared, you're confused, and worse, you are about to stop it. I am Dr. Girnita, a board-certified rheumatologist who has prescribed methotrexate to thousands of patients. And in this video, I will tell you the 10 things that any doctor or every doctor should tell you about this drug. So stay with me because methotrexate is one of the most powerful tools that we have for rheumatoid arthritis and other autoimmune diseases. So if you want to understand it, it will change your life. Pay attention to this because methotrexate was used to treat inflammatory arthritis since the 1980s. And it is the #1 most prescribed drug for rheumatoid arthritis, psoriatic arthritis in the world. And the new EULAR 2026 guideline still recommended for the first time when you start treatment as the first-line treatment. And here it is what most patients don't realize. Most rheumatology appointments are 12 minutes, and there is no time to explain how the drug actually works, what to expect, and what to do when something goes wrong. That's why every week in my clinic, I hear, my doctor never told me that. And today, I'm going to share with you everything. And here are the 10 things that every patient who takes methotrexate needs to know. #1, methotrexate is not a chemo drug and is not at the dose that we are prescribing, and most of the patients are taking this dose. This is the #1 fear that I hear in my practice. Patients, when they hear methotrexate, they panic because they heard somewhere that this is a chemo drug or it was used for cancer patients. And here is the truth. Yes, methotrexate is used for cancer patients, but at higher doses, 10 times or 100 times higher than what we use in rheumatology. And at our dose, the typical dose between 15 and 25 milligrams per week, we use methotrexate for the anti-inflammatory and immune modulating effect, but not for the chemo effect. And this is critical to understand because you are not taking a chemo drug. #2, take it once a week, never daily. I cannot tell you how many serious accidents I have seen because patients were confused about how to take methotrexate and they took it as a daily dose. And this is important because methotrexate, it's supposed to be taken once a week, same day, every week. Now, taking methotrexate daily can cause you to have severe bone marrow suppression and even death. And if you ever take it more than once a week by mistake, you have to call your doctor immediately. #3, your methotrexate pill may not be absorbing very well, so you can ask about an injection with methotrexate. Now, here it is what most patients don't realize. Oral methotrexate absorption is very variable. Some patients absorb 30%, others absorb 80%. And your disease is not responding because your dose is not very high. And that's why your pills that you take might not deliver the drug into your bloodstream. And the injectable form of methotrexate, which is given under the skin once a week, has a reliable absorption. In my practice, I often switch patients from the oral pills to the injections if it doesn't work or if they have severe nausea. #4, folic acid is not optional. You have to take it every single day. Methotrexate blocks folic acid in your body, and that's part on how it works. But folic acid is also very important for your bone marrow, for your gut lining, for your hair follicles to grow, and you must use folic acid supplementation, typically 1 milligram every day, but it can go up to 5 milligrams every day. And this will reduce dramatically the nausea, the mouth ulcers, the hair loss, and liver toxicity. My advice for my patients and you, take your folic acid every day, including the day of taking methotrexate, because it will not interfere on how the drugs work. #5, the first 4 to 8 weeks might be rough. But please don't quit. Every week in my clinic, I hear, I wanted to stop because of the nausea. But here is the truth. Gastrointestinal side effects like nausea, stomach upset, loose stools are very common in many patients for the very first 2 months. And for many patients, those symptoms will fade away. But if they don't, you have the option to switch from oral methotrexate to injection. And you can also add a medication that will dumb down the nausea. And you can also split the dose. But do not quit before you give it a fair trial, sometimes up to 3 months. Number 6, avoid alcohol while you take methotrexate. This is one of the most common questions I get. And the honest answer is that regular alcohol use significantly will increase your risk for liver toxicity. Now, occasionally, intermittent alcohol may be tolerated, but only with frequent lab monitoring. So my advice, be sincere, be honest to your doctor. If you are going to drink, let me know or let your doctor know, because we can monitor your labs more closely. Because those patients that they hide that they drink alcohol, those are the patients that will get in trouble. Number 7, yes, you need lab work, and it's not negotiable, not in my practice. So pay attention to this, because methotrexate requires regular blood monitoring. Before you start, you need some basic labs. You need hepatitis B and C screening, and you also need a chest x-ray. For the very first 3 months, you need to have labs every single month, and then every 2 months, and then, if everything is stable, every 3 months. If your doctor is not ordering these labs, this is a red flag, because liver toxicity and bone marrow suppression are silent, and they usually happen in the beginning of the treatment. But that's why you need labs to monitor those things. And those labs, they have the power to catch them early. Number 8, be careful with antibiotics and any other prescription medication. And this is critical because methotrexate has dangerous interactions with several common drugs. So be careful with Bactrim, because it can cause severe bone marrow suppression, and I have seen it. Probenecid, which is a medication for gout, and that will increase the methotrexate levels dangerously. And be careful with certain NSAIDs at higher doses, because they can affect the kidney clearance of methotrexate. So my advice for you, if any doctor, including your dentist, or if you go to urgent care and they do prescribe you a new medication, call your rheumatologist first. Ask them, is this medication safe for me while I'm taking methotrexate? Because that single phone call has saved many of my patients from serious complications. Number 9, methotrexate is not safe for pregnancy. So please use 2 methods of contraception. I tell that all the time to my patients. This is absolutely critical for women that are at childbearing age, because methotrexate can cause severe birth defects and pregnancy loss. And that's why you must use 2 methods of contraception while you're taking methotrexate. And don't forget to do a pregnancy test before you start methotrexate. Now, if you want to become pregnant while you are taking the methotrexate, then you have to stop the medication for at least 3 months before you are trying to conceive. Now, men on methotrexate should also talk to their doctors before they try to conceive. The data is much smaller than in women, but I would still talk to the doctor. Number 10, methotrexate is one of the most monitored, most studied drugs in rheumatology. You have to know, after thousands of patients, here it is what I tell to every of my patients. Methotrexate works. And when it's dosed correctly, when it's monitored correctly, and when it's combined with folic acid, it can put your rheumatoid arthritis in remission. Yes, we have patients with severe side effects, but those are rare. Most patients, and most of my patients, they do tolerate this medication very well and for a long period of time. And as I said, newer guidelines that were published this year in 2026, they still recommend it as the first-line therapy for this reason. So please don't be afraid of this drug. Talk to your doctor and be very informed about it. Now, let me tell you about a patient that I treated. A 30-year-old woman came to me last year, and she was diagnosed with rheumatoid arthritis. Her primary care doctor had prescribed her methotrexate, which was 15 milligrams once a week as an oral pill. But he forgot to prescribe folic acid, and he also forgot to schedule labs to monitor the methotrexate. And he didn't advise the patient about nausea. By week 6, she was so nauseated that she could barely function, and she wanted to quit. Her hair was thinning, her mouth was full of ulcers, and when she came to me, I made 3 changes. First, I started her on 1 milligram of folic acid every day. Second, I switched her from oral pills to the subcutaneous injection. And third, we moved her dose to midnight, so she would go to sleep, and through the night, her nausea would dissipate. Then 6 weeks later, she had no more nausea, she had no more oral ulcers, she had no more hair loss, and her joint pain dropped by 70%. And the labs were perfect. And this is what I do. Because in many patients, as I said, 40 to 60% of my patients, methotrexate works. But you need to get it prescribed correctly, and you need to get the right monitoring. And if your methotrexate is not working, or if you have side effects that are unbearable, here is what most patients will do wrong. They quit. They blame the drug. They lose years of joint function because nobody adjusted their plan. And I know the traditional system is broken. Into that 12 minutes appointment with your rheumatologist, you get the prescription, you get maybe some follow-up labs, but there is not a discussion about what it means, how to take it, and what is best, the injection, the pill, how to switch between those. And that is why I built Rheumatologist on Call, because when you book with us, you see a board-certified rheumatologist in a few days, not in months. And we offer telehealth appointments across multiple states, more than 20 at this point. You don't need a referral. You don't need to wait in a waiting room. And when you come, you have 1 full hour with a physician, and we cover everything: the medication, the doses, the folic acid need, the labs, what you need to do for planning for your pregnancy, and we adjust your medication until it works, and we adjust the medication that works for you. And when you leave with a written plan and with the schedule for monitoring the medication. And I built this practice because I've seen so many patients that quit a drug that could save their life, simply because no one took the time to explain it properly. So if you need us, you can book a consultation on the link that is in the description of this video. Understanding methotrexate is only step 1. And if you stop here, you're not going to know about what other options you have out there. And this is another video where I talk about the most common side effects that you need to watch for prednisone, because this is another medication that is very poorly understood and used inappropriately in rheumatology in other fields.